My name is Julie, and I had a facelift in November of 2023 with Dr. Hamilton. So I've worked in the world of plastic surgery for over 20 years myself, and actually have worked with Dr. Hamilton for the last 7 years. So of course I'm always interested in how my skin looks and watch the progression as I age. I'm 55 years old. And so I've known for a little while that I wanted to do something, but then both of my grown children became engaged and were both married this year. So I knew I wanted to prepare for both of their weddings. So I felt like the timing was right for me then. So talking with Dr. Hamilton, he is so good about, listening to what your concerns are and then telling you if you're a candidate for whichever procedure is that you think you want, and if he thinks you're going to get a good outcome. He is not a physician that will oversell you on anything or say, yes, I'll do this procedure for you, knowing in the back of his mind it's not the right procedure. So I always look and trust him and his decisions when it comes to my face, of course. And so talking with him was very easy, and we both decided that I was ready for a facelift. And so the conversation was very smooth. He's very reassuring. He's great to answer questions that you have. So it was a smooth process for sure. So of course the night before, I don't think anybody ever sleeps well knowing that they're going to have a major procedure done or being put under general anesthesia. But as soon as I got to the surgery center, Dr. Hamilton was immediately there, as well as the nursing staff, and they all made me feel very comfortable. The anesthesiologist came in and spoke to me, and then Dr. Hamilton came in and does his markings on your face. And so that part was very easy. Recovery was also very easy. The nurses at the surgery center were phenomenal. I woke up in zero pain, had no pain whatsoever. And then going home, and the first night, you want to sleep upright because you've had surgery. So you're looking to keep your swelling down. So I slept in a recliner for the first few nights. But really looking back on it, I had no pain. What I experienced was tightness, numbness, but no pain. I never had to take any narcotics. So it was a really easy recovery for sure. I could see results immediately, and then over the next few weeks, because there is swelling, and swelling can come and go over the next few weeks after you've had your procedure. But I was able to see the progression pretty rapidly. So yes, I do think there is definitely a confidence booster since I've had the procedure done. The numbness that happens kind of around the sides of your face and your ears from a facelift, that takes a little bit longer to heal. So I'm almost a year out from surgery and everything feels pretty normal. There's maybe just a little bit where it still has a little bit of an odd sensation, if you will, but I feel great. The whole thing has been wonderful. So we always encourage patients to look at the website when they're researching procedures. Dr. Hamilton's bio is on the website. It talks about the fact that he's been in practice for over 25 years. Somebody that's looking to have a facial procedure really should look for somebody that focuses solely on the face, which is what Dr. Hamilton does. He's not a total body plastic surgeon. He's facial plastics only. And so that should tell a patient or a prospective patient that this is what this person does every day, and it's the only area that he works on. And that 25 years of experience speaks volumes. Now, me working in plastic surgery, of course, I knew a lot of things going into it, but for somebody that doesn't, what I would tell them is you have to prepare yourself for the downtime. You have to make sure that you have a caregiver for 48 hours with you after surgery. You have to prepare for the fact that you're not going to look like yourself for a few days, especially for somebody that's anxious to get back to work. People often prospective patients will call and say, my child is getting married in 3 months. I'd like to have a consult with Dr. Hamilton. And that's an unrealistic expectation. Number one, just for the consult time. And then number two, for having surgery and being able to heal. I had my surgery in November, and my son didn't get married until June. So I gave myself a good 6 months to recover, just because I know everybody's swelling and healing can be so different. And so patients really need to think about that. They can't, or they shouldn't expect to just call, get in right away, have a surgery, and be healed for a big event.